Hi, Dr. Joe again. This time to talk a little bit about vitamin D in older people. Article from Amsterdam, again from the Clinical Journal of Endocrinology and Metabolism in June of this year. This is from Amsterdam, and they defined old as 55 to 85. And I must say, if that's old, then okay. But anyways, that's their numbers. They, with a lot of difficulty, had a lot of people go through a lot of step testing, walk testing, standing on a chair testing, and what have you. And it was very interesting that a very significant number of people, after a while, and it was only a year study, refused to do the walking, the standing, and all the other things, and refused to have the blood drawn. They were checking the levels of vitamin D. Everyone cooperated initially, but then they've had enough of it. So much for the Dutch and how they want to cooperate with the healthcare looking. But at any rate, this was an interesting study because although the variables are always different for anybody, they picked a value that is really about in mid-range for a lot of other testing and other studies that have been done. As you know, everyone's trying to figure out what's best. So what they found was if you were below this arbitrary number of 20 nanograms, you had the diagnosis of very low vitamin D. And that if you did have that, you flunked your testing. You did not have good testing. Whereas the higher you were on the vitamin D, the better you had physical ability to walk and stand on chairs, for whatever good that is, and a lot of other things that just measure general health and ordinary things of life, ordinary activities of life. So once again, D is very important at any age, and as we've always said, and particularly for those who really have gotten older.